we didn't even know the term bioidentical back then, but I know what she suffered, and she's alive today. She fought valiantly that battle, but this is what we're talking about. So here she is, 84. She's fatigued. You could say, illness has taken its toll. It is a hard battle fighting these illnesses, and she had been given 6 months to live 25 years ago, and what kept her going was all the natural. She combined all the natural with the mainstream, but even with that, it is we're talking about fatigue. It is an exhausting battle to fight these illnesses when we could prevent them in the first place.
Right. And so many people die of being frail.
Exactly.
And what happens is we can bring these hormones back up to more optimal levels, and people don't get frail. And they don't break their hips, and they don't end up in the hospital and nursing homes, and you prevent illness. And that's why, you hear, well, there's no proof that it's anti-aging. Well, it's a bad term, and say, well, we prevent illness. If you may not live any longer, but if you don't have the last 10 years of life where you're in a nursing home and had a stroke or cancer, then yes, it's anti-aging. And I think that's really the key, is you want to prevent these illnesses, is just like you're saying in your whole show, and your focus is really the key, and to live long and healthy and happy lives.
And it's quality of life. What you described, being bedridden, broken bones, this is not quality of life.
Right, and standard medicine will extend that life where, you're in a nursing home. Wow, you live 10 years longer, but you're in a nursing home and can't function, and you have to have full-time help and had a stroke. That they think is a success. That's not a success. Is you want to live higher quality of life for a longer period of time.
Friends, this is Dr. Mary Zenit, and we are with Dr. Kent Holtorf, and you can reach us on the web, www.healthforusall.com. Dr. Holtorf, this is a wonderful, invigorating conversation. It's tragic, but we're very much on our show here with our listeners. We're very much on the same page that you are, and I applaud you for your work. The article that we talked about, you make it very clear that these bioidentical hormones remain the preferred method of hormone replacement treatment therapy. They're preferred. Now, what do our listeners do that know this? They've heard you speak. They know this. What do they do when they go to their doctor, say who's on an HMO and PPO, and say, here's the article, here's the proof, this is what we want? What do our listeners do?
Right, I think it's a good question, and they could bring the article in or just ask around, hey, who's doing bioidentical hormones? Really meaning who's actually willing, which doctors are willing to look at the data, who are willing to continually learn and understand that, there's all this evidence out there, and willing to take the time to find this evidence. And so they may have to ask around. It may take a couple tries and find a doctor that prescribes bioidentical hormones, because I think it's also really a kind of a test. If they're not doing bioidentical hormones, they're probably really falling behind in so many other areas as well. And that's what happens. Doctors, they just stop learning. They just stop investigating. They just show up. And when I talk to doctors, too, about a lot of these therapies, they'll say, well, why should we even learn how to do it? I work in an HMO. I work for Kaiser. They won't allow us to do it anyways. And that's what happens. The doctors just say, and I'm having a tough time making it, and it's not going to be covered. Why should I go through more hassle and learn when I'm just stretched? I'm there till 9 o'clock at night just doing, paperwork. And why should it be worth it? Doctors have just been beaten up, and they've lost that all that drive and that eagerness to learn and to help patients. They've just kind of been beaten down, really, and the whole system has allowed for that.
Well, and like you say, that it really does need to come from the doctors. If we don't unite and say, this is the quality of care we want for our patients, if we don't advocate for our patients, who's going to?
Right.
But it's a huge problem uniting.
And I put a large part of the blame on the doctors. They've allowed this to happen. And so what's happened, they have been content in, again, just providing this minimal care. And what's happened, when you look at the quality care in this country, it used to be a big difference between those who had money and those who didn't. And the people who had money had good care, while those who didn't have very good care. Now it's actually pretty close, but what happens is it's not that the poor has got better care, it's the people who have money have got worse care. And with the whole insurance model, it is allowed, as really what's happened is everyone just gets the same poor standard of care.
Yeah, I would agree. Working in both sectors, the public and the private, the standards are really the same. I would say the only difference is that with our Medicaid clients, they're on such limited income, and I've said this for years, I've wanted to get some good quality vitamins and natural supplements for my patients, and they're on such fixed incomes that they can't self-pay it. They can't.
Yeah, it really is, and that's the problem because, as you were saying, all this preventive medicine is not covered because it's deemed not medically necessary by the insurers. If they don't have to pay for it, they're not. They're going to say it's not necessary. And again, that's the biggest problem.
That's right. Well, Doctor, we talked earlier about fatigue and chronic fatigue. What else can you share with our listeners as some pearls that they can use to take home with how they can prevent and reverse this fatigue?
Well, I think when you look at, for instance, chronic fatigue syndrome, it's a vicious cycle of problems that occur. And we have a lot of information on our website, www.holtorfmed.com, HOLTORFmed.com. And what's funny is, and the problem is, it's a terrible name, and the way the diagnosis is kind of ridiculous. But it's thought to be a wastebasket diagnosis of chronic fatigue syndrome and fibromyalgia. But what we're finding is that we can pick it out on blood tests 90% of the time. And the problem is with medicine, if doctors don't know how to treat it, it doesn't exist. So they go to their doctor and they say they're fatigued or they have chronic fatigue syndrome, the doctor will roll their eyes and say, I don't even believe in that, because they can't help it, so it doesn't exist. And so what we find is the majority of chronic fatigue syndrome patients and fibromyalgia patients, really 90+% have very low thyroid levels. But again, we talked about that, how they're not picked up on standard blood tests. Published a study about 6 months ago on adrenal dysfunction in this illness. And again, 90% have low adrenal function. And giving a little bit of cortisol, a little adrenal hormone back, can help overwhelming majority of patients. A majority will have mitochondrial dysfunction. The mitochondria make the energy for the body, and they're dysfunctional. One study did a muscle biopsy in people with chronic fatigue syndrome and fibromyalgia, looked under electron scanning microscope, 80% of the time it was abnormal. So they can't make any energy. The mitochondria burn the calories to make the energy, so you get an average weight gain of 38 pounds with fibromyalgia. So these patients tend to gain a lot of weight. And the doctor, you're just eating too much. No, it has nothing to do with that. It's really because they're not burning any calories to make any energy. You'll find a lot of chronic infections in these patients, including Epstein-Barr, HHV6. Lyme disease is an unrecognized portion that we diagnose in a lot of these patients. Coagulation defect. Actually, a lot of these patients can respond to heparin, to blood thinners, which is interesting. Neurotoxins. So there's so many. It's a multifactorial, vicious cycle that when you treat enough of those areas, then you get the body back working, and you'll get overwhelming benefit in the majority of patients.